Hey guys, this is Dr. Jason Allen with Proactive Chiropractic and Wellness. Today we're going to talk about ankle dorsiflexion and its importance and how it sets the tone for the rest of the body. The ankles are like the foundation of a house. You know, you see a crack in a wall or something of a house, and a lot of times it's not the wall that has the problem, it's the problem in the foundation. You know, it's not stable, it's not balanced, and therefore it's going to cause a crack or some sort of warping of the walls. A common sign in ankle dorsiflexion, you know, when you're walking, you see somebody that drags their feet. They have poor ankle dorsiflexion, not able to lift the foot to allow for it to pass through. Whenever we look at athletics, you know, somebody that's running, if they have poor ankle dorsiflexion, they're going to have to use more hip flexors and quads to lift the leg up so that we can clear that foot on a swing phase. Immobility of the ankle or poor ankle dorsiflexion is going to create hypermobility or more mobility of the knee and the hip joints. That's going to allow for the knee joint to collapse in or outward, and then that really has a poor effect on the ankle. Okay, so a good test for ankle dorsiflexion is the wall test. We want to put the foot where the toes are just a couple inches away from the wall. So let's scoot it back just a little bit. Okay, we want to keep the foot flat, and then we want to lean forward until the knee touches the wall without bringing the ankle up or the heel up. So you see that her heel comes up just a little bit. I'm going to try to keep that down and push that into the wall. Okay, so if you get that, we'll go back to a neutral position, and then we're going to slide the foot back just a little bit. Okay, and then we're going to repeat those steps. Go into the wall, keep the heel on the ground. Good. Bring it back. Let's go scoot it back just one more time. The heel came up just slightly, but okay, so we're about right there. Repeat. Okay, you see, for her to touch the wall, her heel has to come up. At that point, we're going to keep the foot there. All right, let's grab a piece of tape. Okay, we're going to mark exactly where her toe stops. Okay, and that's our baseline. Okay, so let's do the other side. Just off to the side. Okay, we're going to do the same thing. Going into the wall. You can see that her knee is touching. Okay, scoot it back. Good, and back. And again. So she's going into the wall. Go ahead and touch it, even if it comes up. So her heel comes up right there, and that's going to be where our end range is. So we're going to put another piece of tape down. We want to make sure that we get a left and a right. So she has just a little bit more ankle dorsiflexion on the left side. So we stick those down to the ground, and we go through our different dorsiflexion exercises and stretches, and then we can redo this exam later on and see if we've improved it all. So here we have just a wall stretch. We're using a foam roller so we can put her toe up, creating more dorsiflexion. She's keeping the knees straight. Okay, I want you to lean into the foam roller. There you go. Keep the knees straight. And this is going to stretch out the gastrocnemius, which is the big ball of the calf. Okay, now we're going to go back to a neutral position. Now we're going to bend the knees slightly. Bend, keep going right there, and then lean into it. Now this transitions the stretch down into the soleus. Okay, so the soleus is down here, and then we have the gastroc that's right up here. Okay, so here we're using a lacrosse ball to get a myofascial release of the gastrocnemius. So what I'm having her do is sit on the table, one leg down. Now we're going to pull the gastroc apart, okay, and then lay it flat down onto the lacrosse ball. So you can see it underneath there. And then we're going to go back and forth with the lacrosse ball. Okay, we're just going back and forth through the gastroc muscle. So this is dead on right on the posterior aspect of the gastroc. So now we're going to rotate the toe over so the outer ankle is down. This is typically the most tender spot on the calf. And you're going to go back and forth. You're going to find different levels of the peroneal area of the calf. Okay. Now we're going to shift it down. We're going to put it more on the soleus. Okay. And just go back and forth. It's almost like we're strumming it like a guitar. Okay, here's another way using a lacrosse ball that we can promote ankle mobility. Okay, just anchoring the heel into the ground, lifting the toe, and moving it back and forth over the lacrosse ball. Roll out the bottom of the foot and the plantar fascia. So we don't want to really dig in here. You don't want to make yourself too sore. Just kind of find some tender spots along the bottom of the foot and then concentrate on those. Okay. A lot of times with plantar fasciitis, you're going to feel it more in the heel, and you're going to feel it more in the mornings, especially right when you wake up. And this is a good tool to use to help loosen up that fascia. Okay, for this exercise, we're going to do a lunge. We're just going to lunge out forward, putting resistance on the band. Make sure that your band is anchored to something that's not going to move. Okay, and we want it just at the bottom or the distal end of the tibia. We're going to lunge forward and then really push that knee towards or forwards over the toe. Make sure that we're keeping the heel of that front foot on the ground and allow for the band to pull the tibia backwards and promote more dorsiflexion. So another tool that I like to use for ankle mobility is the voodoo floss. So our voodoo band. So what I'm doing is I'm going to start it underneath the foot, wrap it around, get a good base. Okay? We want to focus on the tightness of the band being on the bottom of the foot and the back of the ankle. Okay? So I just bring it across, really pull it tight. You're going to overlap about 50% of the band. Not too bad in the front. Really pull it tight underneath. Okay? I'm going to go one more time underneath the heel. Pull it tight. Make sure it's flat. Nice and easy over the top. Okay. And then we're going to go tight across the Achilles tendon. Probably good there. So we'll pull it tight one more time. Then anchor it in. Okay, so here we're going to push the ankle up in a dorsiflexion. The band's really holding the Achilles tendon and the plantar fascia tight, and then flossing it through. So I want to thank everybody for viewing today, and make sure that you check us out on Facebook, Proactive Chiropractic and Wellness. Check us out on Twitter, it's Proactive BCS, and Instagram, Proactive Chiro BCS. I'm Dr. Jason Allen. I'll see you later.